Today I am going to talk about osteophytes. Do you know why people get osteophytes? As a physio, we get patients whose MRI or the X-ray report states that the patient is having osteophytes as one of their findings. These osteophytes are nothing but a growth of the bone in response to the load that it is getting imposed on. So to bear that load, the osteophytes are grown as an attempt of the bone to take more load. So whenever there is an osteophyte, think that the bone is getting undue stress more than what it can tolerate. So it is trying to expand its coverage area by growing a new bone. This is more common in people who are having arthritis or a spinal problem. In the spine as well as in the knee, we have a cartilage called as fibrocartilage, and this fibrocartilage in the knee is called as meniscus. In the spine, it is called as the disc. This disc and the meniscus, as with age, tend to get degenerated. Sometimes even young people, due to the undue load, it can get degenerated. Sometimes it can get injured. That can lead to degeneration pretty quicker. So the bones will be having to take more load because of the deficiency in the cartilage. The function of the meniscus in the knee joint and the function of the disc in the spine is to take the weight, transfer the weight and distribute the weight equally in all the areas of the contact surfaces. The contact surface here, the contact surface here should get equal force that is done by the meniscus. For example, if the meniscus is degenerated like this, at some part of the contact surface of the bone will get more force compared to the other part. The part of the contact surface of the bone, if it is getting more stress, it will try to adapt by growing a bone onto it. So that growth is called as osteophytes. So that's why the meniscal tears and the disc degeneration are to be addressed as early as possible to prevent the wear and tear of the joint very early. As a physio, your job is to protect the cartilage, preserve the cartilage and load the cartilage in a way that it is not going to damage so fast. At the same time, it can perform its job. When you see an osteophyte, think that the joint is already undergoing some abnormal load. The bones are literally struggling to take the load. That's why the osteophytes are formed. So in such cases, you don't have to address the osteophyte, rather you address the reason for osteophyte, which is the degeneration of the meniscus or the degeneration of the disc in the spine itself. Without preserving, protecting and doing the load management for the meniscus or for the disc, whatever other exercise you give, it may not be fruitful, because ultimately at the end of the day, it's a compression which is the problem. Did you learn something new today? Thank you.